Hello, Mix. Firstly, thank you for the question. This is a really relevant question that in our previous live Q&A call, we were actually talking about this. There was a lot of talks about like pre-myopia. So I see that this is a topic that you guys are really concerned about. And of course, I do want to address it. So thanks for posing the question here. And we're going to get straight into it. All right. So it said that, so this is a challenge with pseudomyopia. So there's a couple of BV stuff involved in assessing children while taking into account myopia, so particularly pseudomyopes. So you encounter a patient recently was a minus 050, so that's manifest, but her cyclorefraction was about plus 0.25. Okay, so does not seem like real myopia. Doing a lot of new work, plays the piano about 1 to 2 hours 3 times a week, homework 1 hour a day, and some reading. So just from this, I can tell that this particular patient of yours does a lot of like close-up work, a lot of new work. Okay, so something we want to consider. Outdoor time was also poor. Okay, okay, so this is something that is actually also pretty common, I guess, with kids who tend to spend a bit more time indoors. They just don't spend as much time outdoors and whatnot. And then also that mom is currently monitoring for visual hygiene. So both parents are myopic. Okay, both parents myopic. So this itself tells me that in terms of their genetic factors is pretty strong. So when we have patients who have really strong genetic factors, we just want to probably monitor them a bit more closely. Yeah. So when we assess BV, she was has some esophoria with manifest refraction, both distance and near, high ACA ratio. Okay, this is a big one. Good job, Mix, on finding out about the ACA ratio. Okay, so you figured that probably multifocal might be the best management, but wasn't sure it was the best practice given that her vision is pretty good unaided already. But overall, find that pseudomyopes are a little tricky. So, any thoughts? Yeah. So, firstly, Mix, this is actually a very good question from yourself because pseudomyopia is not something that we want to take lightly for, and we definitely want to dive into it. Firstly, good job on pretty much finding out all the information. I like the fact that you not only look at the refraction, but you also did look at the binocular vision also. So that's actually super duper critical, and I think something that we can all learn from a bit more also. Okay, so what I would usually approach this is, of course, a parent's mindset. So, firstly, parents have to be willing to really get on top of things, in order for us to really have the best chance of like making sure that our patients not get even more myopic over time. Okay, so with what you're doing, I don't think there's anything wrong, even if you decide to go with a multifocal lens, because that actually helps in terms of when she's reading. We don't want her eyes to be like converging too much. So giving a bit more plus to just relax it, especially because she's esophoric, that might be a good idea. Also, the fact that she has a high ACA, this means that she is more prone to getting myopia. Okay, like in terms of the progression. So there has been studies which found that pre-myopes actually accelerate. They actually get myopic much quicker. So pre-myopes with high ACA ratio, they actually increase the chance of them just progressing much more than those who are like pre-myos but have lower or normal ACA ratio. Okay, so but a few things also that we can have a look at is actually the more recent studies, yeah, that has been done. Okay, so I would like to just show you guys around. So this is one of the studies that has been done. Okay, and has been shown. Just make myself a bit smaller here. Okay, yeah. So has been shown to actually slow down myopia progression. So the first thing that we can do is actually get them to spend at least 13 hours outdoors a week. Okay, so that's not a day, a week. So if you see it on average, that's almost 2 hours a day. And yes, and the reason why that number is crucial is because of this particular paper that was done back in 2017. Okay, so although it's a 2017 paper, but it's actually still super relevant. Okay, so if you guys want to read the full thing, you can just click over here, or I will leave all the links in the comments so that you guys can like click on which one you guys want to. So free full text here. All right. So this particular paper did show that kids or pre-myopic kids who actually spend more than 13 hours outdoors are less likely to become myopic, all right, than those who actually less spend less than 13 hours outdoors. So this is a paper that's worth reading, or at least just skimming through, so that you guys would understand that. Now, the second thing, there's actually three different papers on this. It's actually about atropine. Okay, so this particular one is actually for 0.01% atropine that they did on a group of Chinese population kids. All right, and it did show that it actually did help to slow down in the pre-myopic kids. Okay, so we don't have the full free text for this one, but this study was done pretty recent. So this was published just in June 2023. So that's very, very recent, very good. And then there's also another study here that was done on an Indian population, published back in January of 2022 with 0.01%, which also showed that for these pre-myopes, it did really help to slow down egg cell elongation. All right. So as you can see, there's actually a lot of evidence. And to top off on that also, 0.05% atropine. For this particular study, there's a free full text here that you guys can click on. It shows that 0.05% atropine. So this is a group of like Chinese kids primarily in this study, the LAM2 RCT, which also did show that it helped to slow down. So this is to say that like atropine might be one of the ways. If let's say parents are really reluctant to really get onto this different treatment options, this is the one that you guys might want to have a look at. Okay, and then let's go on a bit further to talk about low level red light. Now, the reason why I don't really focus too much on this is because I do understand and I do know that like not a lot of us, and even myself, I do not have any access to low level red light instruments as for now. But maybe in the future, as it gets more and more prevalent and more practices have it, this is something that we can have a look at, because it has been shown already to actually really be really effective to prevent myopia for the pre-myopic kids. Okay, so as you guys can tell, like this is the shift now, towards finding out about pre-myopia in the studies, because we know that there are so many things that are actually working. So what's not working, sorry, what is not what's not working, but what can make us get the kids not to become as myopic. And the last one, which some of you guys might be really happy about, okay, is actually spectacle lenses with highly aspheric lens lit. Okay, so this has been shown to slow axial elongation. Super recent study. All right, so as we're talking now, uh, Mick, is that we're now in October 2024. This was published in August 2024, literally 2 months ago. So this was very, very recent, and it did show that the HEL lenses, in a way, are really helping to slow down. And we know that there is one company that does HEL lenses, and that is Essilor with their Stellus lenses, right? So, guys, yes, there's no study yet for MyoSmart or all the other lenses, or even like with the Zeiss MyoKit. There's no study on it just yet, but at least we know with the Essilor Stellus lenses, for look at this, low hyperopic Chinese children. So these are those who have low levels of hyperopia. It has been shown to actually slow down axial elongation. There's no full like free paper on this, so you can't really read up too much on it. Yeah, but you know what? This shows us that is it. Oh wait, sorry. Actually, I'm wrong. I think you are able to read it if you click on this link. Yeah, so this is probably one of the. It is an open access paper, so you guys will be able to have a look at it. I did briefly had a look at it, and one thing that I saw was that one of the challenge they had was actually to get these kids to really wear and to really use the glasses itself. Yeah, because of course it's going to be much more challenging to tell these kids to really use their glasses when they have really good vision. But if you are for some reason able to convince them that, hey, look, this is something that will work really well, and it's something that can be applicable, because in the study it shows that as long as they're wearing the lenses for more than 30 hours. So yes, if they're wearing for more than 30 hours a day, sorry, not a day, 30 hours in a week, all right, then it will be very effective. So if you were to break it down, that's just a bit over 4 hours a day. All right. Yeah. So if you can get into the lenses for at least 4 hours a day, it can be pretty effective. So maybe, and of course, you want to wear them to wear these lenses primarily when they are in an environment, both, if they're in school or if they're back home. So this can be a bit tricky because again, these kids have good vision. So how do you get kids with good vision to wear glasses? Maybe you can make it like, hey, these are cool glasses. Do you want to wear cool glasses like the rest of your friends? Maybe, you know. So you guys have to be really creative about this. And again, this study is super recent. It's only been about 2 months. The evidence, the authors did say that this paper is only out for a year. There's a trial period that they were doing it for. So of course we need longer studies, much more longer, in order for us to know if it's going to be truly effective. Okay, yeah. So this is what we have gone through, and also maybe just to share one particular case. You know, I don't know why, Mix, but when you sent me this question, I literally got a case. You know, just yesterday of a pre-myopia, and you know, just to share a bit with it, I just have some of my notes here. um so came in, told mom that like he's been having some like eye pain slash blurry vision for like the past 3 4 weeks. So seems pretty recent. I thought he just wanted to get glasses because mom was like, one of his friends recently got glasses, so maybe he just wants glasses. Now the refraction that I did beforehand, all right, before he yeah when he was in the room itself, so I got like a minus 0.75 with a minus 0.25. So minus 0.75 on the right eye, minus 0.75 on the left eye. Now, even before I refracted him, when we checked his vision, mom could already tell that his right eye wasn't seeing as well as his left one. But mom thought, hey, he might be faking it, right? So sometimes parents do feel this way. So what do you do? Personally, for me, I cycle them, okay? But to be honest, because he is a I mean, he is a super low myope in that threshold, you know, of that pre-myopia or not pre-myopia. So I was like, he just could be accommodating, probably. Maybe that's why. So I did cycle him, and when the results came back, it was still the same, still minus 0.25 on the right, minus 0.25 on the left. Now we know it's not really like pseudo myopia anymore, but it's like true myopia. And that's why when we manage it, right, for this particular patient, I also have an access to a biometer in the store, and his axial length on the right eye was sitting at 23.80, left eye 23.61. In translation, he is sitting at the 60th percentile for his age group. Okay, so anyone above 50th, you know, has a higher chance to grow a bit quicker. Anyone above 75th percentile is like super duper quick growth. So we can tell that he's not slow, but he's definitely in that slightly quicker range. So that's the reason why we decide to like go with MyoSmart for him. And plus, because mom just does not want him to progress as quickly as possible, we decided to also actually put 0.01% atropine. Okay, so it was pretty convincing in a way. Yeah, I'll show you guys one way that I actually use, which this is one of the resource in the resource tab of this group. If you guys have a look at it, let's see. So it's called the Brian Holden myopia calculator. This is the one. Okay, so let's hope we're able to load it. Yeah. Okay, yeah, so mine is loaded already. Okay. All right, so he was Caucasian, 7 years old. Now, this is tricky because, like, do I put him as a minus 0.25 or do I put him as a minus 1? Because there's no option for, like, in between here, okay? Yeah. So, again, the myopia management option, you can literally click any one of it. You know, I just leave it to the default anyway because the main idea is that I just want to show parents like what can happen if you do something for the kids or not do anything for the kids. Okay. All right. So all right, yeah, I'm just gonna put myself just right here, maybe. Yeah, okay, this is good. So as we can see here, if we look at the line chart itself, right? If we were to not do anything about his myopia, by the time he's 17, he might be a minus 3.54, minus 350 roughly, right? But if we help to slow it down, we can maybe get him down to minus 2.23 or minus 2.25. So this is what we want to do for him. We want to make sure that, you know, he doesn't really progress too much in a way. Yeah, and so mom understand that he's growing, he's still gonna grow. So what can we do to really slow down? Now, guys, just take note with all of these different options here. Some of it has is like slightly older and whatnot, so it might not be as. If you want to see the reference study, it's all over here. Is the one at the bottom. So this was 2021, 2019. So they combined some data from the study to extrapolate all of this right over here. Okay, yeah. So let's say so we are going to be doing MyoSmart for him plus also low dose 0.01% atropine. So this is what that's gonna happen. So hopefully by the time he's 17, he might maybe a minus 1.75 or 1.81 here instead of being like a minus 4 almost at 17 years old. Okay, so when parents understand that the main idea why you want to do myopia management is because you really want your kids vision to not progress as much, they usually are a bit more open to it, right? Yeah, when of course I also do talk to parents about, look, there's some long-term effects on his eyes, that might not be good. For instance, like people with myopia has been known to have higher risk of retinal tears or detachment, higher risk of getting like glaucoma, and myopic maculopathy, or basically like like their central vision they won't be able to see as well. So again, this is not to scare parents, but this is just let them know that these things can happen. Okay, yeah. So I just want you guys to be aware of everything that we've talked about today. Thanks again, Mix, for the amazing question. Yeah, amazing question that you have. And also, it was just so funny because about 2 days ago there was actually a conference, no, not really a conference. There was a CPD event by Cooper Vision, and actually Kate Gifford was talking on it. And also, she was talking about pre-myopia. Yeah, so all the references here, I can't credit myself for it. Yeah, so I did actually saw one of Kate's presentation, and then like she was talking about all these different research papers. So shout out to Kate Gifford, who's honestly the Australian OG for like myopia stuff. Yeah, so if you guys, I would highly recommend to like follow her group. Also, they do talk more about like really high level stuff in a way. Yeah, and the purpose of this main group here at Myopia Talks is that I do want to make sure that you guys get most value out of it. Even if you feel that you have something like a super simple question, just ask it, because like we're here to help each other out, and that's what I want to do. Okay, all right. So thanks for tuning in to this video, and Mix, I hope that really helped to answer your question. So long story short, what you're doing is great. Yeah, with the idea of the with the idea of the multifocal. But even if you were to get her straight into some sort of a myopia control lens, like the Stellus lens, right, it might be something that's worthwhile doing also. And if you can't convince parents to get her into glasses at all, then probably it's worthwhile to at least get her more than 13 hours a week outdoors. Okay, that would really be beneficial for her. And then also consider atropine, because atropine has been shown to be successful in pre-myopes. So if there's evidence out there already, why are we not using it? I know there's side effects, blah blah blah, but again, we have to think like in terms of the research studies, it has shown to be very safe and effective. So if it is, then why not? All right, so thanks for the question. All right, and yeah, I'll catch you guys in the next one.